Good afternoon, Mr. Chair. Dr. Oto.
Good afternoon, everyone. Dr. Jenkins, Dr. Orto, how are you?
Wonderful.
Doing
Good.
great.
Awesome.
Hello, Dr. Jackson, Dr. Wright.
Hello.
Hello, Dr. Jenkins. How are we doing today?
Fantastic.
Awesome.
Mr. Brown.
Good afternoon.
Hello, Mr. Brown. I feel like I haven't seen you all in a month of Sundays.
Yeah, it's certainly been a while.
Yeah, unfortunately, I wasn't able to make the last two. But I'm here. I'm back.
Tony Malott, how are you?
I'm doing well, doing well. I hope you are.
Awesome, I am. Thank you. Good to see you.
Nice to see you and everyone else. It was a beautiful fall day today.
It sure was.
Gorgeous. Gorgeous. I hope it stays like this for 3 months.
It's my
I
favorite
know it
season.
won't, but I hope it does.
Yeah. Well, I just walked out there a few minutes ago. It's a little chilly now as the sun is set, but it's still nice.
All right, so it looks like we do have quorum. So I will call this meeting of the Durham County Board of Health to order at 5:00 p.m. on October the 10th. Again, hello everyone. Hope everyone is doing well, enjoying this beautiful fall weather, and hope you have all enjoyed some semblance of a summer vacation. But we have our meeting here, so we will begin. Hopefully everyone has had an opportunity to review the minutes and the agenda as presented or as printed and disseminated. I will entertain a motion at this point to approve the agenda or make any amendments that might need to be necessary. Did I hear a motion?
Yeah, I motion Roger to approve.
Okay. So we have a motion on the floor. Do we have a second?
Second.
Very good. It's been moved and properly seconded to approve the printed and disseminated agenda. Do we have any unreadiness? Any discussion? All right, well, I will allow the question to be called. Is Ms. Murphy on the call? I think she's here. but we're ready for the vote. We're ready for the vote.
Good evening, I'm here. Okay, Dr. McDougall,
Yes.
Dr. Ray,
Yes.
Commissioner Alam, Dr. Miller,
Yes.
Dr. LaRon Jackson,
Yeah.
Dr. Rosemary Jackson,
Yes.
Dr. Orto,
Yes.
Joshua Brown,
Yes.
Anthony Gregorio,
Yes.
and Daryl Glover.
Yes.
Thank you.
All right, thank you all. The next item on the agenda is approval of the minutes from the August meeting. I will, at this time, accept a motion to approve the minutes or to amend those minutes.
Motion to approve as is.
Second.
All right, it's been moved and properly seconded. If there's no question, we will call for the vote.
Okay. This is Donna. Dr. McDougall,
Yes.
Dr. Ray,
Yes.
Commissioner Alam, Dr. Miller,
Yes.
Dr. LaRon Jackson,
Yes.
Dr. Rosemary Jackson,
Yes.
Dr. Ordo,
Yes.
Josh Brown,
Yes.
Anthony Gregorio,
Yes.
Daryl Glover.
Yes.
Thank you.
Thank you. Ms. Murphy, are you aware of any public comments that have been brought forward for this evening's meeting?
No, I have not had any. I have
Very
not heard anything, no.
Very good. All right, well, we'll move on to our staff and program recognitions. We'll give the floor to Jenkins at this time.
I'll be very brief, and this is an opportunity for me to recognize the entire staff. As you already heard, and gives me a great deal of pride to say publicly once again that we are the best public health department in the state of North Carolina. As recognized by the North Carolina Public Health Association, we did receive this beautiful trophy and a check for $1,000 to use any way that we see fit. But in our fall education conference in Cherokee, we were recognized as the large health department of the year. I could not be more proud of the staff, but more importantly, we were recognized primarily for our amazing track record of community collaboration. But then we were also specifically recognized for the Partnership for a Healthy Durham and recognition of their 20th anniversary and all that they do. And coming on the heels of that, there was a Winter Institute for Community Health Assessment, which was held on yesterday, in which we were also recognized for an outstanding community health needs assessment and excellence in our community health improvement plan. So again, when I say Durham leads the way, I truly do mean it. But Mr. Chair and this board, we could not be who we are and do the things that we do without the support of this wonderful board. So it pleases me to let you all know that your health department is the best in the state.
Yeah.
Awesome. Thank you. Thank you.
Yeah.
And congratulations again.
Yeah, absolutely.
Our staff, but particularly to our leader and director, Dr. Rod Jenkins. So thank you and congratulations.
Thank you so much. Appreciate it.
So that's a high bar now. So we have to keep that up.
I think we're up for the
Every
challenge.
year.
I know you are. I know you are. It's
Right,
awesome.
right. Awesome. Well, we'll move on to our administrative reports and presentations. Our first presentation of the evening is the zoning ordinances for tobacco retail outlet density, and Natalie Thompson will be presenting that report for us today. Ms. Thompson, you have the floor.
Thank you so much. Good evening, everyone. I'm Natalie Thompson. I'm the Region 5 Tobacco Prevention Manager. I'm based here at Durham County, and but I do cover the 9 counties in Region 5, and I help to promote tobacco-free spaces and policies to help prevent tobacco use. And that's one of the things that I wanted to talk to you all about tonight. I should also say that I am in the last days of my role here as the Region 5 Tobacco Prevention Manager. I am the first Region 5 manager based here in Durham County, and I've been really proud to help Durham County lead the way in the region, as we have done for many years. And I'm looking forward to seeing what happens in this role after I leave. I will be going on to work at the North Carolina Tobacco Prevention and Control Branch. But tonight, I wanted to present to you about a promising local strategy that I wanted Durham to think about. And I thought, what better way than to present to you all to see if this is something that Durham would be interested in doing and following suit in some of the other counties that have already been able to do this. And I am having trouble sharing my screen.
I think they probably got to make you a host.
No, it looks like my mouse is giving me problems, but
It's coming up.
is it? Okay.
There we go.
And then are you all seeing the slideshow or are you seeing my desktop?
It's not
It's a slideshow, but it's not in presentation mode.
Okay, got it. No problem. There we go. Everything good?
Yes.
Thank you so much, y'all. Okay. So as I mentioned, I'm going to be talking a little bit about zoning ordinances, which is a new promising strategy that a lot of other jurisdictions in North Carolina have been able to utilize as a way to prevent youth vaping in our community. And I don't know if you all saw this, but I wanted to start off with a clip from this documentary that WRAL just did, because I feel like the young people interviewed here and the stories from this documentary and in this clip explain what we're dealing with youth vaping better than I could. And so I'm going to start by showing you this clip. Are you all hearing the sound from the video?
No.
No. Okay. I think I will. Apologies, y'all. I feel like no matter how much you prepare for these situations, it inevitably
I think you had to go into your settings and
yeah.
allow for sharing of audio in
Yeah, I
addition to
do. And I think
screen sharing.
I think I just did that.
Okay.
So fingers crossed, y'all. Let's hope this works.
Says they can't sell vapes to minors. They sure do.
But they don't call.
Are y'all hearing that?
So Natalie, we are hearing it, but the video, at least on my end, is not moving. I'm just
Okay.
seeing the
Yeah, because I paused it to
Okay.
check to y'all. Okay. Okay.
Hard, I can tell you that much.
As someone in tobacco prevention, I mean, how easy is it for a teen to get vapes?
It's fairly easy. That plays out in the numbers that we see.
1 in 8 high school students vape in North Carolina.
Start please with "my name is."
It's not just the numbers.
You're gonna look right into the camera.
It's what we heard from every young person we interviewed. The kids who want to vape can. We talked to young people in anti-tobacco groups.
And I've seen it first.
The video is not working, Natalie. I'm sorry.
Oh, okay.
Like you're still not like sharing your screen, Natalie.
Oh, sorry about that. Wow.
Apologies. Technical support is on the way.
No, I got it. I got it. I saw what I was doing wrong. It's really
Okay.
me. It's me, Marcia. It's Can you see it now?
We see Gorgia on the screen. Mhm.
Okay.
I think we're tracking now.
Great. Okay. Thanks, y'all, for bearing with me. I appreciate it.
Firsthand, where once it starts with someone else, then it spreads to another one, and the whole friend group starts vaping.
So actually, my football teammates We were using vapes before and after practice.
We interviewed a teen in treatment for vaping.
I couldn't go to sleep without it.
And talked to young people we met on the street.
It's just kind of like everyone does it.
They all said vapes are easy to come by, no matter how old you are.
And kids also get them from their friends. And where their friends get it is vape stores.
I always paid like someone in my grade to go get them for me.
Like just about anybody could get access to vaping.
I mean, there's so many vape stores. How is this gonna work?
So we checked stores ourselves.
How are high schoolers even able to have these devices in the first place?
So I'm gonna put this on you. This is a camera. And we just want to see if you get carded.
Maybe the fact that they can walk across the street and purchase a vape.
Did they card you?
No.
Maybe practice.
We interviewed a teen in treatment for vaping.
I couldn't go to sleep without it.
And talked to young people we met on the street.
It's just kind of like everyone does it.
They all said vapes are easy to come by, no matter how old you are.
And kids also get them from their friends. And where their friends get it is vape stores.
I always paid like someone in my grade to go get them for me.
Like just about anybody could get access to vaping.
I mean, there's so many vape stores. How is this gonna work?
So we checked stores ourselves.
How are high schoolers even able to have these devices in the first place?
So I'm gonna put this on you. This is a camera. And we just want to see if you get carded.
Maybe the fact that they can walk across the street and purchase a vape.
Did they card you?
No.
Maybe that's a good reason why.
Next.
Okay, what else? What are we missing?
A big thing that we're missing here is how we got to this point. It's really crazy, and it started with Jewel.
I was one of these folks who saw the trend lines of how much high schoolers were stopping smoking. And then all of a sudden, some mad scientist in California came up with a new way to deliver nicotine.
Juul was one of the first companies to produce synthetic nicotine in a way that wasn't cost prohibitive. Nicotine in and of itself is very astringent, tastes pretty nasty, but with Juul, they were able to manipulate that pH level to lower it so it didn't taste as bad, so people could get deeper inhales, take in more. That is a recipe for addiction.
We have a generation of youth who are now addicted to e-cigarettes. We had worked for decades in North Carolina to prevent this and recognize that really one company was going after kids.
North Carolina Attorney General's office commenced an investigation into Juul. And what they did was they used flavors to attract kids. They used very high concentration of nicotine to get kids addicted quicker because their mind was, if we can get them addicted, they're a customer for life. And then they marketed the product aggressively. They used Instagram and these social media influencers to make it look so cool so that teenagers wanted to replicate that lifestyle. What's so sad is that it worked beyond their wildest imagination.
North Carolina was the first state to sue Juul. They settled before it went to trial.
And we won $48 million plus a series of changes to how they do business to protect young people.
It really brought resources into North Carolina, but then while researchers were focusing on Juul, the industry was creating products like Elf Bar or Esco. And when I ask adults, have you ever heard of that? They say, no. I said, well, those are the number 1 and 2 products that were used by youth around the United States in 2023.
New vape companies and products have saturated the market.
They don't look like ugly, gross, scary, smelly cigarettes that they learned about in school. They look like the latest, greatest tech device.
I can see now vape products have Bluetooth connection or even Wi-Fi that students can connect to.
I even saw a vape that looked like a USB stick.
Make it look like pens.
I don't know any adult smoker who has use for a vape pen that looks like a highlighter.
I mean, why are they making vapes that look like Yoda? Why are they making a vape that looks like a highlighter marker or goes inside a hoodie?
In 2023, the FDA sent warning letters to 15 companies who sold vapes that look like cartoon characters, school supplies like a highlighter, a vape that looked like a camera, and one disguised as a coffee cup.
This is a game of whack-a-mole at this point, and what we need in this country is a national standard of no flavors because flavors are what attract kids.
According to the CDC, vapes can contain cancer-causing chemicals, heavy metals, and some flavors linked to serious lung disease.
We know that approximately 90% of high schoolers and 95% of middle schoolers who vape use flavored products.
Why are they tasting like Fruit Loops? No 50-year-old wants something that tastes like Fruit Loops.
Those flavorings often have harmful effects.
We have products coming in from all different places, so these are not all American-made products.
"800 shops in Wake County can sell tobacco products, and more than 13,000 stores sell tobacco products across the state.
The more you see it, the more you think everyone does it.
Gorgia, one of the teenagers we met at the Poe Center for Health Education, started counting the vape stores near her home.
I was passing by 17 vape stores, and you can double it to 34 because I was driving every day from my home to my school and then school and back home.
Nikhil, another teen advocate, did a project where he mapped out all of the vaping stores near his high school in Raleigh.
There were a total of 86 vaping and tobacco outlets within 2.5 miles of Enloe High School. So with the amount of vaping outlets near a high school, it makes it super easy to purchase a device where you could vape.
I'm Delaney Kearns, I'm 21.
We sent a news production assistant at WRAL into a dozen vape stores to see who would ask for an ID.
Thank you. Thanks so much. Y'all have a good one.
It's a button cam. We're going to put this on you and then just send you into the stores. And really, we just want to see when you buy a vape if they ask for your ID. So we're going to get you a button-up shirt. We need something with buttons. All right, shirt is on. I'm going to put this on. Goes right through the buttonhole.
Delaney is 21, so we weren't breaking federal law, even though in North Carolina, the age to buy tobacco is still 18. Either way, stores must ask young people for an ID before selling to them. We hit vape stores all over Raleigh, including some on NC State's campus.
Do you have a receipt?
Yes.
What happened?
I just pointed at it. I said, can I have that one? Thank you so much. And yeah, then I paid and left. I never got asked about my ID.
This happened at every shop on day one.
You guys don't have like elf bars or anything. Thank you. Have a good day. All right. Well, thank you so much.
Did anyone say, oh, you don't have your ID, you can't get this?
No.
The next day, we hit 6 more stores, including a drive-through.
No questions were ever asked about ID or age. Thank you so much. You have a good one.
Just 2 out of the 12 total shops said she needed an ID to buy a vape.
And you have all these products, you don't even vape?
No, I've never vaped a day in my life and I don't plan on it.
Okay, so as you can see, that that documentary clip shows a lot of the issues that we're seeing with youth vaping, and a lot of these issues aren't necessarily issues that can be solved at the local level, because they involve making decisions at the state level or at the federal level, like the flavorings, for example, or like changing the age to 21. However, there are things that can be done at the local level. And so some jurisdictions, towns, cities, and counties have started regulating the location of vape and tobacco shops, particularly when it comes to having these shops around schools and around places where youth and young people may congregate or may hang out, simply to reduce the amount of exposure that young people have to these products so that they're not as normalized and so that they are not as accessible. This map shows the counties and municipalities that have already adopted these ordinances. So you can see that both Orange and Wake County have adopted tobacco and vape retail zoning ordinances, as well as multiple cities in Wake County. Chatham County is also due to pass their ordinance at the end of this month. And that this is what some of those ordinances look like. So oftentimes there are UDO amendments to the current Unified Development Ordinance that a jurisdiction has in place. Wake County was the first to implement something like this. And so they said that any vape or tobacco retailer must be at least 1,000 feet from any other tobacco or vape retailer, as well as away from schools, public parks, greenways, and residences. And other counties and jurisdictions have followed suit. This is just a snapshot of some of the different types of zoning ordinances that have been put in place. So counties and cities and towns have kind of taken the approach that best suits them, but we also have some model language based on what we've learned from other counties and jurisdictions that have implemented these. The most recent county is Orange County to pass their UDO amendment. And this is a snapshot of what that looks like. So it basically states that tobacco and hemp retail stores must be at least 1,000 feet from any other tobacco or hemp retailer, schools, parks and rec facilities, and residential places. So I've been contacted by a variety of folks here in Durham about why Durham hasn't done something like this. And I have talked with the planning department. I have put during an Engage Durham session, I have put in a request that this be looked at as part of the new UDO, which I know that the planning department is working on right now. However, because I've gotten a lot of community feedback about what folks are seeing here in the community and seeing that other jurisdictions have already taken steps to pass an ordinance or pass a UDO amendment, I thought it would be a good idea to present this to you all to see if maybe passing a UDO amendment would be something that Durham County might be interested in rather than waiting for the new UDO, which could take a longer time before it is, which takes a long time to develop. So these are just some possible next steps that I wanted to outline for you all, and wanted to make sure that I brought this information to you and answer any questions that you might have about this strategy, about what other counties or cities have done.
Yeah, I have a question. I'm sorry. So let me first say, great presentation. I did watch the entire video and was just amazed at the information there. Impressed with our Attorney General, because I think he was the first Attorney General in the country to sue these vaping companies. So I was impressed by that. But as far as the UDO amendments, do we have any data that shows the effect that these UDO amendments have had on use of vaping and hemp material products with our youth? Not
Yes.
necessarily in North Carolina, but even throughout the country.
Absolutely. Yeah. So there's an organization called Counter Tools that is a national organization that has done a lot of research on the impact of tobacco retailer density and the relationship between that and youth initiation to tobacco use. And it has a huge impact on the youth initiation, the normalization of tobacco use. And it's considered one of the most promising ways to reduce youth initiation in a community is to reduce the density of retailers in a community, as well as to reduce the accessibility by having retailers be a certain distance away from schools and other places where students are going to be congregating or young people will be. So yeah, there is a lot of data, and I'm happy to send that to you. I mean, I don't have specific statistics because there's a whole website dedicated to that. But it is considered one of the most recommended ways to reduce youth initiation right now.
Awesome. I think Dr. Ray had a question.
Natalie, thank you very much. Great presentation. Something that's close to my heart as one of these shops opened up right across the street from my son's school and a youth opportunity center and a church. So I've been looking into ways to promote this. One question I had around this, around how other areas that have enacted ordinances have dealt with existing stores. Were they grandfathered in? Do they have a period of time where they're supposed to move? How does that work if we were to be successful in promoting this and implementing it?
Yeah, that's a great question. Other jurisdictions that have implemented these ordinances, they do not apply to existing retailers, right? So it would just be any future retail establishment, right?
Yeah. Okay. Great.
Yeah.
Thank you very much.
That's what's recommended.
And there might be maybe this is just part of what the ordinance is, but is there, just the whole concept of not IDing someone and not having any stricter guidelines or enforcement around IDing. What do you know what group in the state actually regulates and oversees these shops? And do they have any teeth around enforcement of the ID requirements?
That's another great question, and something that needs to be addressed at the state level because we currently do not have a tobacco retailer licensing system in North Carolina. We're one of a very few states that don't. And because we don't have a retailer licensing system, it is extremely difficult, first of all, to track where any tobacco products are being sold, as well as holding retailers accountable and doing compliance checks because there is no sort of database that we can go off of, which is what a licensing system really lends itself to, as well as the ability to hold folks accountable by revoking their license, similar to what we would do with alcohol. And this has long been a recommendation for North Carolina when it comes to tobacco prevention. But again, that's something that would need to happen at the state level. So currently, there are compliance checks that are being done by state contracted agencies. So here we have Insight Human Services that does our compliance checks in Durham County. But they run into a lot of barriers and challenges, like the ones that I mentioned about not having a list. The other barrier and challenge that the folks that do the compliance checks for the state run into is the fact that our state law says 18. And so they do their compliance checks based on the state law.
Thank you very much.
Commissioner Alam has her hand up. Go ahead, Commissioner Alam.
Hey, y'all. Sorry, this may have been answered or discussed in the presentation. I joined a little bit late. But has this been proposed or brought forward to Sarah Young in the planning department? Okay.
Yeah, so I met with Lisa Miller and we had a series of conversations and we talked about putting this into the new UDO. And then I realized after a lot of community members had reached out to me that there was a lot of interest in maybe taking some action before the new UDO gets passed. And I thought that having a body like the Board of Health look at something like this, I think could be very helpful since it is about protecting the health of our young people. And so I thought I would just bring this to you all's attention. And but I have talked to the planning department about this. At the time that I talked to them, there wasn't a lot of capacity. It was about a year ago to take this on, if you can imagine. And so there may be more capacity now. And I have reached out to them and I'm awaiting a response to see what they say. They were saying that we could put in an application for a text amendment. But if it goes through something like the Board of Health, then we could have just a conversation with them directly.
Okay. Yeah, because I don't see this being anything that at least this board and even probably the next board of commissioners and city council being opposed to. I just wonder, just because in North Carolina, the General Assembly controls so much about zoning that local governments can do. So wanting Sarah Young's team to run it through of is it legal within the parameters of what all the restrictions the General Assembly has put on local governments.
Yeah, that's a great question, and we're really lucky in the sense that we've already had multiple counties and jurisdictions go through this process. And Wake County was the first. They implemented theirs more than a year ago. They worked very closely with the School of Government to make sure that that the language in their ordinance was going to be in compliance with all of the state requirements. So that's something that we have kind of been through as part of the process. And we have folks at the branch and folks at the School of Government that we regularly call on whenever a city or town or county is putting together an ordinance and wants to make sure that the language is correct.
Okay. That's great. And then my last thing is, I know since capacity was an issue at the planning department, if you want, I can connect you. I know it was a controversial subject, but the people who brought forward SCAD were like a citizen brought forward text amendment. I can connect you with them to, share with you how they brought that forward themselves, not through the planning department, if that would be helpful in any way. I can connect you to Aaron Lubeck.
Yeah, I mean, I definitely would take the contact. I think it would be great if this came from um if this came from both the community and from within the local government sphere.
Absolutely. Thank you.
Thanks.
Thank you. Dr. LaRon Jackson has her hand up. Dr. Jackson.
Thank you. My apologies for being off camera. I'm in transit from clinic, but I do want to thank you for the information that you presented. And I have a question regarding any other types of statewide initiatives to perhaps reach communities that are not already saturated with these vaping and tobacco retail outlets, so that they can perhaps put these UDOs in place, before the community becomes saturated.
Absolutely. So, I'm just one of 10 tobacco prevention regional managers, and I know there have been a lot of the regional managers have done just that. So they've been focusing on some of the smaller rural communities in the state. And actually, a lot of those places have already passed ordinances. So some smaller communities that were kind of seeing that wave coming have been able to pass ordinances in the past year. So this is definitely a statewide effort. We've been working, like I said, with the School of Government, with the state tobacco branch to put together recommendations for an ordinance, and then, language that would be in compliance with the state. So it's something that we are working on throughout the state, and just really trying to do this in partnership with local government. And so, getting the word out there that this is possible, that local government has the power to do this, and that, and also working with local governments when they have the capacity to actually implement an ordinance.
Thank you.
I had another question. As far as action items for this board, is there something that we could be doing even this evening to move this discussion along forward, perhaps before going to the Board of County Commissioners? Any advice as to what we as a board could do to help this come along?
Absolutely. I think if the board is interested in supporting something like this, I think contacting the planning department about a text amendment is one step that you could take. I would also say expressing interest in moving something like this forward and working with the planning department on something like this, I think would be very helpful. And I think if you all have, I've talked with folks in the planning department myself, but I'm one person and I have the word tobacco prevention in my title. And so I think that it means a lot more if the communication can come from a wider body.
Gotcha.
Would you think that perhaps a letter of some sort signed by the board members might be helpful. Is that a particular way that we could
Yes,
escalate this?
I think that would be very helpful. Yes.
And Mr. Chair, members of the board would be more than happy to craft that letter with under the advisement of Natalie Thompson to ensure that that is done if that is the wish of this board.
Yeah, do we need to put this to a vote? If so, I'm happy to entertain a motion to proceed with the letter endorsing the UDO amendment for Durham County.
I support and motion to vote around that support.
Do we have a second?
Second.
All right, it's been moved and properly seconded. Do we have a consent vote? Or we'll put it to a voice vote. I'm sorry. Probably for the record, we need to have everyone to weigh in. So if there's no unreadiness, we're ready for the vote. Donna?
Okay, thank you. Dr. McDougall?
Yes.
Dr. Ray?
Yes.
Commissioner Alam?
Yes.
Dr. Miller?
Yes.
Dr. LaRon Jackson?
Yes.
Dr. Rosemary Jackson?
Yes.
Dr. Orto?
Yes.
Mr. Brown?
Yes.
Mr. Gregorio?
Yes.
Mr. Glover?
Yes.
Thank you.
Thank you. And I did see Mr. Gregorio's hand up a little earlier. Did you still have a question, Anthony?
Yes, thank you.
Yes, sir.
Ms. Thompson, great presentation. This is really more of a topical question, but have we seen pushback from the big tobacco industry, especially with North Carolina having tobacco roots?
That's a great question. I know that, with Wake County being the first, I think that they did a really great job of inviting in, tobacco and vape retailers into their process, to kind of work through what some of the barriers or the challenges may be. Ultimately, grandfathering in existing shops, I think, has helped with any of the pushback that could be anticipated. I think that this actually, in some ways, can be helpful for existing shops because it cuts down on their competition. And so, as long as we're approaching it from that angle, I don't think there hasn't been pushback in that, as long as we approach it from that angle.
Gotcha. Thank you.
Just a comment here. In viewing the video, I did get the impression that big tobacco does have a fairly strong lobby in North Carolina, as I think only 2 legislators were interviewed, but neither of them were willing to take a stance on changing the age from 18 to 21. So, so I think that's certainly a consideration down the road, but we can do something here at the local level to make this less of an issue for our youth, especially. So, but again, thank you. Great presentation.
Thank you all so much.
All right. So we'll move on to our next presentation, which is on child fatalities. And we have Cheryl Scott that will offer that presentation this afternoon.
Hello, everyone. I'm getting my screen prepared. Thank you.
Sure.
Hi, can everyone see my screen?
Yes, ma'am.
Wonderful, thank you. Good afternoon. My name is Cheryl Scott. I am a public health nurse program manager here in the Medical Services Division in Durham County Public Health. I want to begin by apologizing for the couple of errors that in the presentation that you all received. And if anyone is interested in the corrected copy, I'll be happy to forward that to Don Murphy. Thank you. This afternoon, I'm going to be talking about Durham County Child Fatality Prevention Team. I'm going to be providing a 2023 status update. I'm going to be providing an overview of the North Carolina child fatality review processes at the state and local levels, updates on the legislative changes for the child fatality review process, 2022 Durham County child deaths, and we'll provide a short summary of identified systemic issues and then a summary of all of this. The North Carolina Child Fatality Task Force is a legislative study commission that examines data surrounding child deaths, strategies to prevent these deaths. They make recommendations to the governor and to the General Assembly to prevent child deaths, prevent abuse and neglect, and they support the safety and well-being of children throughout the state. This Child Fatality Task Force is connected to the broader North Carolina Child Fatality Prevention System created by state statute, in 1991. This includes multidisciplinary teams across the state who review child deaths, and this would include Durham County as one of the 100 local teams in place presently. We identify and respond to gaps and deficiencies in systems that are designed to prevent child death or maltreatment. The Child Fatality Task Force is considered the policy arm of this system, and they do not review individual cases of child deaths. The Child Fatality Task Force makes recommendations to prevent child deaths. They promote child well-being, and these recommendations become part of their annual action agenda, which is included in an annual report to the governor and the General Assembly. A little bit about Durham County's Child Fatality Prevention Team. I want to start off by saying that there are actually two types of local review teams in every county. The first is the Community Child Protection Team, CCPT, and they review cases in which a fatality resulted from suspected abuse or neglect, and there has been involvement with social services. The local child fatality prevention teams review all other child deaths not reviewed by the community child protection teams, In most counties, as it is in Durham County, these two types of local teams meet in a merged capacity. The purposes of child fatality prevention teams are to identify deficiencies in the delivery of services to children, to make and carry out recommendations for changes that will prevent future child deaths and promote understanding of the causes of deaths. The goals of these teams are to involve diverse agencies and disciplines, orient, inform, and involve professionals who serve children, collect uniform retrievable data on all child deaths, to share these results, and to link child death patterns and trends with agencies and groups that can create and support strategies to prevent child deaths and identify system problems. To act, to try to assist in preventing child deaths and to assist in the reduction of the number and rate of child deaths. Future changes to the North Carolina Child Fatality Prevention Team system. The specific, legislation that makes these changes are via the 2023 Appropriations Act. They became law via this act. These changes are being made because the North Carolina Department of Health and Human Services is committed to preventing child fatalities in North Carolina. The new legislation generally addresses recommendations that were made by the North Carolina Child Fatality Task Force. The goal was to strengthen the child fatality prevention system in North Carolina. These changes are scheduled to take place in January 2025, and a second part involving data training, July 2025. This legislation, how will this change the local team operations and responsibility? We try to keep in mind that planning some aspects of this implementation are still in process. There's a lot that the local teams have not received as far as how this process will be initiated. We are updated monthly by our team coordinator, Ms. Carrie Young. And as we get updates, we will definitely provide those to our health directors for DSS and for public health. There will be a new state office of child fatality prevention at the Division of Public Health, DHHS, with a team of staff whose primary role will be to provide training, tools, resources, and technical assistance that will help the local teams do their work effectively. This state office will also have a role with data tracking and analysis, as well as compiling aggregate information. And DSS is currently working to shore up and stand up this new office. Instead of having both the CCPTs, the Community Child Protection Teams, and the Child Fatality Prevention Teams, the CFPTs, there will be one local team with nearly the same membership as the current Child Fatality Prevention Teams. These teams have the option to be one single county team or form a multi-county team with one or more other counties. These teams will continue to submit any recommendations annually to the Board of County Commissioners, and these changes are intended to take place January 2025. This new local unified team will not be required to review all child deaths. This is a change. Durham County currently reviews all child deaths. Instead, these teams will be required to review the following categories of deaths: undetermined, unintentional injury, violence, motor vehicle, child abuse or neglect, CPS involvement, sudden and unexpected infant deaths, suicide, deaths not expected in the next 6 months, and a subset of additional infant deaths that do not fall within any of these categories. The teams will have the option to review more than these required categories, but only required to report on the deaths within the categories that I just stated. This change is also scheduled to take place in January 2025. Excuse me. The local teams will continue to have the ability to request records necessary to carry out the purposes of the reviews. Starting July 1, 2025, information from required reviews will be collected via the use of a national data system. We're really excited about this. The information from the child death reviews, including the team recommendations, will be collected via the use of the National Fatality Review Case Reporting System. It's designed specifically for this purpose and is used by 48 other states currently. Specifically, we will be receiving assistance in training. The state office will train teams on the use of this system and provide technical assistance. Data entry, while many of the acronym NFR-CRS for the National Fatality Review Case Reporting System, They have many variables based on best practices that can be tracked. The teams would be initially asked to focus on a much smaller subset of priority variables. Data analysis, reporting, and follow-up will allow local teams to analyze their data from these reviews, generate reports on that data, and to use this information to inform local prevention efforts. Per the legislation, aggregate information from this system, including findings and recommendations from local teams, will also be analyzed by the state office to generate aggregate de-identified reports. The data agreements and security, DHS is currently evaluating data use agreements that are required for the use of this system and is engaging in a data privacy analysis to assure the appropriate protection of information. The reviews of the fatalities related to child maltreatment and or where there was CPS involvement have specific procedures that will require technical support from DHS, and the state office. These changes are intended to take place in January 2025. There's also some additional funding for local teams. It has not been decided how that funding will be distributed. The North Carolina General Assembly appropriated $189,000 of the recurring funding to support local teams. Currently, as I said, there are 100 local teams. As counties decide if they want to merge with other counties, they will take that fact into consideration when they are distributing these funds. The duties of the local DSS director and the local health director are largely the same as the current statutory roles. The citizen review panel functions will be restructured. As currently, the 100 county community child protection teams serve as the federally required citizen review panel. The citizen review panel legislation sets out requirements that will lead North Carolina DSS to create panels to meet federal requirements with at least 3 citizen review panels who are to evaluate the work of local and state child protection agencies. A new citizen review panel structure has not been finalized, and these changes are also scheduled to be effective January 2025. Local teams will no longer be required to review active CPS non-fatal cases as the community child protection teams have been doing. Review of these cases becomes optional in collaboration with local DSS directors. This change is also intended to take place January 1, 2025. In 2023, the CCPT-CFPT reviewed 33 Durham County child deaths. This is down from previous years. And I also want to say before going forward that the reviews are received by each county a year after the death has occurred. So in 2023, the teams reviewed 2022 child deaths. So I will begin by going through and just defining the manner of deaths and how many that Durham County had in that time period. A natural death you see here is due to an internal factor that causes the body to shut down. There was no external reason for the death. Durham County had 13 of these deaths. And to avoid violating privacy laws, because our numbers are so small, I can't really separate each case because just in case, I don't want to violate any privacy issues with any families. But most of the natural deaths that we reviewed were due to birth complications. Babies were born before full term and took at least one breath before dying. A lot of pregnancies ended because of extreme immaturity, which means that the baby was born at 21, right around 21 to 24 weeks, but it could have been from anywhere from mostly 18 to 26, somewhere within that range. One death that was categorized as natural, as the team kind of dug into it and looked at all the events and the statements and the occurrences around this death, it raised red flags for human trafficking. What we do not do is second guess a medical examiner, but we will look at external circumstances that are associated with this death and keep our eye out for other cases that may be similar. And if we see a trend beginning to emerge, we will set that aside to possibly vote as to whether or not these need to be investigated further by the team by setting up a subcommittee to make some planning, to coordinate some planning for the issue. Excuse me. The definition of an accidental death: unintentional deaths caused by injury, poisoning. There isn't any actual evidence to prove there was intent to harm or cause of fatality. We had non-accidental deaths. These included sleep sharing, that included motor vehicle accidents, drowning. And sometimes we saw suffocation and strangulation listed as an accident. The actual events were similar to those that may have been a safe sleep concern. Among the finalized infant fatality cases within the medical examiner's system jurisdiction, includes potentially compromising sleep spaces that accounted for 64% of the state's finalized infant fatality, excuse me, that totaled 135 deaths, that's 64%. Of those deaths, 29 were classified as accidental. Some were classified, 106, as undetermined. And the number of sudden infant death syndrome cases are excluded, as they are not considered sleep-related deaths. So that is to also try to help explain when I said earlier that, accidental or another type undetermined may be assigned to a death, but it may have other implications or concerns associated with that case. So we have homicide here. Homicide is this year for 2022 and for the review year 2023 was particularly concerning to our team, because I can honestly say that for the past 3 years, most of these homicides have been by gun violence. And the team is currently deciding on some other subcategories to look deeper into, and we're going to place homicide probably on that list for discussion. A lot of these homicide deaths included teens and maybe some gang involvement. I can't say for sure, suspected for sure. And it seems to have a lot to do with tempers, territories, drive-bys. And we are, like I said, looking at how we can, as a team, develop recommendations and look at systems to provide to the community and to our state team regarding recommendations about what we as a community may be able to do for these homicides of these babies, children, excuse me. Suicide. the act of intentionally killing oneself. We had suicides that involved, you see two here, but they could have been gunshot wounds, hanging, and that's just about the main categories of death that we have seen by suicide: gunshot wounds and hanging by teenagers, teens, and at times preteens. When you see undetermined death, as I said earlier, safe sleep it may not be maybe a factor in undetermined deaths. And we see safe sleep concerns of some of these deaths. But the reports usually describe events that were the result of bed sharing or other sleep sharing events that resulted in a child, usually 1 year and under, stop breathing. A lot of times this included people who are unhoused and maybe living in the weekly hotels that you pay by the week, but did not have a home of their own, or were living with several other people in a large home. We had 4 deaths that were determined to be undetermined, excuse me. For the summary of identified systemic issues were the same as reported in our previous report in 2022. Several infant deaths appear to be related to unsafe sleep environments. Excuse me. I'm happy to say that we did get a subcommittee together this year. We're still meeting, but we did have the opportunity to get some resources for traumatic grief to support children and families. We have a list of those resources that we also got from Safe Sleep, the Safe Sleep Center at UNC Chapel Hill. And we also were able to, with some funds arranged for the team by our county commissioner, Carter, who's a member of our team, we were able to begin a safe sleep campaign by distributing door hangers throughout the community. We're still trying to get all the data from the agency that distributed these hangers. They were safe sleep hints and clues and phone numbers and resources where people could contact if they had concerns, wanted further information. We asked for Spanish translated door hangers. We were unable to get those this year. And we also asked for specific zip codes, and we're waiting on those. But so as I say, we started that. We have not completed this initiative, and we plan on adding more to it. We have a subcommittee for safe sleep already in place, and we will continue to meet and plan for this upcoming year. And lastly, I just want to say that going forward, we are going to consider using a health equity framework in fatality reviews. And what this would be the health equity is the ethical and human rights principle that motivates us to eliminate health disparities. Child deaths are not distributed equally across the population. There are long-standing systemic inequalities, racism, and historic and ongoing oppression that drive the disparities broadly, including disparities in child fatalities. Our case reviews should never become a context in which to place blame on community agencies and individual providers. and teams should never place blame on families or parents for the loss of their children. What we want to do is to focus on individual risk levels of instead of focusing on the individual risk factors of personal behavior, the team would focus on systems level factors that individuals may respond to in unhealthy ways. Systems level factors impact the most people. They're frequently oppressive, and their improvement promises to increase health and well-being. A non-judgmental inquiring approach seeks to ask, what drives the behavior that we observed? What about the root cause, and what is behind that? So the team will take a look at this. We will, of course, vote on it and see if we want to include this strategy as we move forward in reviewing child deaths, looking at systems, and developing recommendations. And I just want to close by just reading this. It's from the Child Death Review Team and the National Fatality Review. The death of a child is a heart-rending loss to the family and the community. We, the teams, want answers and the understanding of how and why the child died. These answers can provide understanding of risk factors and inequities that they may not identify otherwise. And lastly, I want to say that I like to give kudos, much respect, and many thanks to our teams. These are hard cases to review, and our teams are great. We have experts from all over Durham serving on this blended team, and we're really, really proud. I'm really proud to be a part of this team. And that concludes my presentation. I'm happy to try to answer any questions.
Thank you, Dr. Scott. Very sobering topic, and we thank you and your team for the work that you've done. Certainly understanding better how these child fatalities occur will help us and the health department to help to reduce these numbers in years to come. So we want to, again, thank you for the work that your team is doing. If anyone has any questions, we'll let you have the floor at this time to ask those of Dr. Scott. Okay, I don't see any hands up. So once again, Dr. Scott, thank you again, and we'll be thinking of you and your team as you work on this very difficult and sensitive subject.
Thank you. Thank you for your attention. Thank you.
Yes, ma'am. Yes, ma'am. All right, we're going to move on to our reports, and certainly the board and others have the opportunity to ask questions. We'll start with our health vacancy report for the months of August and September. We'll give way to our director, Dr. Rod Jenkins.
Thank you again, Mr. Chair, and to the members of the board. Just proud to say during these months, we did see a precipitous drop in our vacancy rate. The last time we met, it was at 13.5%. Currently, it was sitting at 12.4%. So that kind of lets us know that we're trending in the right direction. Proud to really say that a lot of these vacancies are not necessarily from a negative impact per se. We did have some new positions. We did have some promotions. And we also did, unfortunately, have the end of a grant, a huge grant that we had, which really precipitated some vacancies. But with that, we continue to trend in the right direction. We hope that trend continues.
All right, thank you. Thank you. The next report we have is our notice of violation report for the same months, August and September. Is Mr. Salter on the call?
Yes,
Yeah,
sir.
there
Can
he
you hear
is.
me?
Yes, sir.
Very briefly, I think there's some good notes on here. So if anyone does have a question, feel free to ask. But I always like to point out the positive ratio that we had 6 or 7 compliant NOVs versus the 4 new NOVs that we added. And at least one of those NOVs that we added is due to damage and it's not effluent. So that's always good. One thing that you might have noticed on this report is the 3855 Anger Avenue. It doesn't have a compliance date, even though it's on the compliant list. But if you notice, the notes say that there has been a there's been a flag placed on it, basically in the LDO system, that places a restriction on issuing a certificate of occupancy until that property has been connected to municipal sewer, or the owner has applied for and received a permanent pump and haul permit from us. That property was sold after we issued the initial NOV, and the new owner has not occupied the property. So it's no longer technically an NOV because there's no effluent surfacing. But if someone was to move in the house and they turned the water back on, they started using fixtures, it definitely would fail again. So that's why it's on the list, but it's not truly compliant. It's just not, it's not an issue until somebody moves back in and starts using water. I would like to say that we are continuing to work very closely with Attorney Malott and County Legal, and she had the privilege of riding with Patrick Eaton this week and going out and actually firsthand witnessing some of these NOVs, so she could get a real feel for how bad it could be or what it actually looks like, which I think was eye-opening for her. There's no other questions. That's all I have.
All right. We'll entertain any questions from the board. I don't see any hands up. So again, thank you, Mr. Salter, for your explanation of the items in the NOV report. We have our health director's report for August of 2024 next.
Again, Mr. Chair, thank you. And to the board, we thank you for hanging in there with our new format. We'll continue to be as expedient as we can. With 17 pages of a health director report, it's always hard to identify one or two that I'd like to really bring out. But I'd be remiss if I did not give kudos to Natalie Thompson, who you heard from. She is listed within the NOV report. Just want to thank her for all of her work and her representing Region 5, which is a 9-county region. She's done a marvelous job in doing things to really promote tobacco cessation, and just really always available to my other colleagues in the other counties. As she mentioned, she's leaving us to go on to greener pastures with the state of North Carolina Tobacco and Control Branch. But as I joked with her today, I'm glad that she's still on the same team. And she's a resident of Durham, so she's not too far away. But again, we want to really lift up the work that she's been doing, not just in Durham, but also in the other counties. Also want to really pay attention and draw your attention to our firearm injury prevention partnership. We were challenged by County Commissioner Wendy Jacobs to formulate a campaign to really get more information out to the masses, and the gun safety team, or our firearm injury prevention partnership, as it's now called, heeded the charge. And we did have a very nice public service announcement and billboards and radio spots, just really emphasizing the tagline, "Your car is not a gun safe. Secure your gun and lock your car." So again, while I was traveling to Durham, it was a pleasure to see those billboards out, and even more delightful to see the public health logo. So again, I'm thankful that they were able to heed the charge. And as mentioned previously to this board, we were anticipating the hiring of an opioid settlement manager, and that manager is in place. His name is Jason Smith. And we were also successful in selecting an individual to really help out with our harm reduction initiatives, and that person has been hired as well. So we look forward to presenting those individuals at a future board meeting. But suffice to say, they have hit the ground running as depicted inside the health director's report. Again, they're hired. They have articulated the finer points in a form of an annual impact and financial report, comprehensive training with our budget team to make sure that the finances are in order, because as explained to me, it's a very intricate situation with reporting and making sure that the funds and everything that we spent has been approved and are settling to the dime. And also, they are in the process of setting up an opioid settlement task force advisory planning committee in the form of coordinating with Durham Joins Together. And that is the big collaborative effort that we've had in place for quite some time. So we look forward to the great work that's going to be done by this initiative and these funds, really in an effort to get these funds out into the community. And rest assured, the board will be apprised of all those activities. Back to you, Mr. Chair.
Thank you, Dr. Jenkins. Obviously, lots of great work that's taking place in our Durham Health Department, and we thank you and your leadership for allowing these things and spearheading these efforts. I did have a quick question. As far as the firearm safety, where can we advise folks to go? Is it the sheriff's office, the police department, to pick up gun locks, lock boxes?
You can actually steer them in our direction.
The health department.
We tend to have them, but again, under the leadership of Willa Robson Allen and Donna Rosser, they have, I guess, a wealth of storage capacity. They have a lot of gun locks, so we'd be more than happy to do it. But again, we partnered with Durham Police Department and particularly the Sheriff's Office in order to make it happen.
Thank you. All right. Any questions? Oh, there's Mr. Gregorio. We'll give you the floor, sir.
Yes, thank you. Congratulations on the hiring of the new program manager and the specialists for the opioid settlement. My question is for the director and also the finance director. In terms of the training, if you could just maybe give me a high level of what that training might entail in terms of, financial responsibility. Are there, controls in place and such? Obviously, it's a very large settlement, so we want to make sure it's responsibility across the board.
I'll do my absolute best, and hopefully Micah can help me. But there is training that's available through the North Carolina Association of County Commissioners. They have an entire team that's dedicated to, I guess, providing technical assistance, Mr. Gregorio. So that's one facet of it. But then there's also this entity called NC Core. And this NC Core is the grand purveyor of all the funding. Per general statutes and per settlement administration, you have to get everything approved through there. So there's training involved with that. There's specific funds, as you would imagine. These funds have to be separated, and it's an entire cost center that's specifically set up just for these funds. So they're not necessarily housed in public health. The activities are, but those funds are there. So with that, Finance Administrator Gwendon has been somewhat gracious in doing her best to make sure that we are the grand purveyor of those funds and making sure that everything flows through public health as far as documentation is concerned. Mm-hmm. As depicted inside the report, we do have a number of other departments within the enterprise to include the Office of Emergency Management, Medical Services, the Sheriff's Department, and Justice Services Division, you name it. Everybody's kind of gunning for an opportunity to really put forth those initiatives. So, again, the training was a little, I dare not speak because I didn't attend the training, but the training is a bit involved, and it does require you to kind of, us to have a team, so to speak, to make sure that we go to that training and to really be participative inside that cohort to ensure that we're doing everything we're supposed to do. I welcome any additional input that Finance Administrator Gwendon may have.
That's a great summary, Rod. Appreciate that. For the board, I would just mention that, we have our systems in place for when you all approve budget amendments and we go through a specific form, we get approval from you all, then those funds go on to the commissioners and through their processes that way. There's just a couple of additional steps with the opioid funds due to their nature, and that involves a portal from NC Core, as Dr. Jenkins said. And so we're in communication with them. And I think a lot of our work has gone on to kind of take this from the other folks who have been working on this in the county up to this point, since public health is now sort of taking a lead on it. And so they've been doing a pass off to us and making sure we have the right contacts, we have the portal access we need. And then Jason, the opioid manager, and I have been meeting also with county finance and county budget to make sure that everything is set up there. So as Dr. Jenkins said, these funds are held outside of the general fund, and all of our other activity is inside of the general fund. So there's a couple of nuances to them in that regard, but it also allows us to keep them separate and keep an eye on them kind of separately. I am going to include an opioid slide on my quarterly presentations to you all moving forward. Next time we meet, I'll be presenting that, and we're adding that opioid slide now, so you all will be aware of the pieces that are public health related.
Gotcha. Thank you very much. Just as a follow-up, from my understanding, I was looking at the presentation from this past summer for the opioid settlement. Does the manager have total ownership of the budget, or is it more of a teamwork or coordination kind of processes between the finance director?
It is definitely continued coordination. So with that, it's a situation in which the opioid settlement funds are certainly under the purview of the entire county. So we do seek hire from, certain general managers to include, assistant county managers to include Assistant County Manager Dwayne Brinson and Assistant County Manager Joanne Pierce, who are at present working collectively to ensure that those funds are being spent correctly.
Excellent. Thank you so much, Director, Dr. Jenkins, and Ms. Gordon. Yeah.
Yes, sir. Thank you for the question.
All right. I don't see any other hands raised, so we'll move on to any, I don't see any other committee reports. Any old business that we need to address? None listed on the agenda, so we'll move on to new business. We have 3 budget ratifications, and I'll leave that I'll give way to Director Jenkins to present those.
Thank you again, Mr. Chair, and again to this illustrious board. We thank you for your wherewithal and bearing with us with our new process and our new rotation. I would just say, again, we will leave it up to you to vote to approve all of the above, to include ratifications and new amendments. But for the ratifications, the 3 that were mentioned, the board is requested to approve budget ordinance to approve the submission of a letter to North Carolina Department of Health and Human Services outlining the aggregate percentage change of 0% to Public Health's charge master. This letter that we will send to the state reflects Public Health's aggregate charge master changes to applicable codes between July 1st, 2023 and July 1st, 2024, which is 0%. The second ratification is the board is requested to approve budget ordinance to recognize funds in the amount of $196,508 from NCDHHS Division of Public Health. These funds will be supporting foundational service areas, core functions of Durham Public Health. So the third is the board is requested to approve budget ordinance to recognize funds in the amount of $60,234 from the Duke Endowment through Duke Health. These funds will be used to support the Partnership for Healthy Durham, a coalition improving the health of Durham's residents. An annual amount of $150,000 has already been awarded to our agency for each year through fiscal year 27-28. $89,766 has already been approved for fiscal year 24-25's budget. This amendment only requests the remaining award to be recognized. Those are the ratifications. Mr. Chair, I'm happy to go into the budget amendments if that's okay with you.
Absolutely, please do.
The board is requested to approve budget ordinance to recognize funds in the amount of $120,000 from the North Carolina Department of Health and Human Services, Division of Child and Family Wellbeing, Whole Child Health Section, School, Adolescent, and Child Health Unit. These funds are intended to strengthen and maintain a strong and inclusive school health team by supporting school health program activities to foster healthy students who are in school and ready to learn. Specifically, these funds will be used to hire a contractor position to serve as a member of the school-based health team to provide COVID-19 response, recovery, and resilience in schools. The second amendment, the board is requested to recognize $8,000 from the North Carolina Public Health Association's Dr. Ann Wolf Mini Grant Award. Once again, we did not only win Public Health Department of the Year, we also got that $1,000, and we also were awarded an Ann Wolf Mini Grant in the form of $8,000. So we walked away from fall conference with about $9,000. The funds will be used to address food insecurity and lack of food access to nutritious foods by increasing outreach and education for the Triangle Double Bucks Farmers Market Support Program during fiscal year 2024-2025. The third amendment, again, was the $1,000 that I just mentioned. The board is requested to approve budget ordinance amendment to recognize $1,000 from the North Carolina Public Health Association for winning the Dr. Sarah Taylor Morrow Large Health Department of the Year Award for 2024. And finally, the board is requested to approve budget amendment to recognize $230,000 from the North Carolina DHHS Division of Child and Family Wellbeing for evidence-based, evidence-informed behavioral health interventions. The funds will be used to increase the number of community-led social, emotional, and mental health programs that support the mental health and well-being of historically marginalized children, youth, and families in Durham. That concludes the budget ratifications and amendments, Mr. Chair.
Thank you, Dr. Jenkins. If there are any questions or comments regarding the ratifications or amendments, we'll hear those at this time. Seeing no hands, I will entertain a motion to approve the 3 budget ratifications and the 4 budget amendments at this time.
Second.
Okay. It's been moved and properly seconded. Do we have any unreadiness? Any questions? All right, we're ready for the vote.
Dr. McDougall?
Yes.
Dr. Ray? Commissioner Alam? Dr. Miller?
Yes.
Thank you. Dr. Miller?
Yes.
Dr. LaRon Jackson? Dr. Rosemary Jackson?
Yes.
Dr. Orto?
Yes.
Mr. Brown?
Yes.
Mr. Gregorio?
Yes.
And Dr. Glover?
Yes.
Thank you.
All right. Our next item is we'll hear any agenda item suggestions for our next meeting, which will be in December.
Yeah. Damn. You'll see lots of sun. You can expect a high.
Any suggestions?
Mr. Chair, I'm pretty sure that there's going to be some required presentation, so we'll keep you posted. But as mentioned previously, Mr. Chair and members of the board, we would love to present our new opioid settlement manager for your consideration so you can meet him. It's not new to public health, but great guy, and I think we hit a home run when we selected him.
Very good. We look forward to it. All right. We have an opportunity for informal discussion other than everybody's ready to go. I see glazed over faces.
Well, I think
No,
I saw
it was a great meeting. That was a lot of really pertinent information.
Yeah, absolutely.
Yeah,
absolutely.
it really was.
Stuff. Yeah.
I also saw a future board member with Dr. LaRon Jackson's.
That's right.
peer in. So
few years, but coming, right?
Oh yeah. And by the
Awesome.
way, let's see. This might be my last meeting.
December meeting will be your last?
Yes,
Yeah, okay.
I think.
Until we
I don't
change
know.
your mind. Unless we can change your mind.
No, I think even I wanted to change I don't know if I could. But anyway, it's coming up. But
All right.
that's a story for another time. So it was a great meeting. It was great information. So thank you all, staff and board members.
Absolutely. Absolutely. All right. Well, it is that time. I will entertain a motion to adjourn.
So moved.
All right. It's been moved.
Second.
And I hear a second. Any unreadiness? If not, we're ready for the vote.
Dr. McDougall,
Yes.
Dr. Ray,
Yes.
Lom,
Yes.
Dr. Miller,
Yes.
Dr. LaRon Jackson, Dr. Rosemary Jackson,
Yes.
Dr. Orto,
Yes.
Mr. Brown,
Yes.
Mr. Gregorio.
yes, and enjoy your autumn.
Thank you. And Dr. Glover.
Yes.
All right. Well, once again, congratulations to our staff and health director for just outstanding work all year long. And the culmination being the awards that you received at the meetings. Thank you. We will see each other again, if not before, in December.
Indeed. Thank y'all so
All right.
much.
Take care.
Absolutely.
Bye.